to Biztechasia Health and Wellness Show. Today we speak to Clarence Zhang. He's the co-founder and country manager for, Clarence, I gotta do housekeeping. So your title is co-founder, country manager, of
Mednefits. Mednefits. So it's benefits, right? But with a medical in front.
Mednefits.
So Mednefits.
Okay.
Yeah, Mednefits.
Okay.
Yeah.
Okay, I'll start again.
No problem.
Okay, 3, 2, 1, we start. Welcome to Biztechasia Health and Wellness Show. Today we speak to Clarence Zhang, the co-founder and country manager for Malaysia for Mednefits. Now, Mednefits is a B2B employee medical benefits platform that makes it easier for businesses to take care of their employees with automated, affordable, and accessible benefits. Now, to tell us more about this, welcome to the show, Clarence.
Hi, Brian. Good to be in the show. Good to see you.
Clarence, for a start, could you give us an overview of the business and how you started it?
Sure, no problem. Okay. So what we do, right, is we provide employees benefit to companies. So we started with a small team in Singapore, so providing corporate health benefits. Then we realized there's actually a gap between what the client wants and then what the markets have. Okay, so what do I mean is typically companies that wants to provide employees benefit to their employees, they will buy an insurance plan to cover for them. But not many companies can actually buy an insurance plan because it's actually quite expensive. So what they do is they actually do the pay and claim method. So we call it the reimbursement method. So employee go and see a doctor or go and see whatever that the companies can provide for them first, and then they can claim back later. Okay, so that method is actually cheaper, but it's actually more troublesome. So the clients actually being faced with whether to pay for higher costs, okay, which sometimes they can't afford, or doing something that is more tedious for them. So that's where we come in and we solve the gap by providing a platform for the companies to administrate their employees' benefit.
So you are essentially a tech platform.
Yes, we are a tech platform. So we are powered by tech. The clients, the healthcare providers, even the HR themselves, they have our technology to help them to solve all their employees' benefits needs.
Okay, so walk us through the solution itself. What are the areas that it covers within a company's, say, a large company with multiple subsidiaries? How do you help them?
Sure. So as I mentioned just now, okay, either the companies provide insurance coverage, okay, which don't really covers for the employees if they don't fall sick or go to hospital. So that benefits will be wasted. If not, they will do the pay and claim. Pay and claim will be cheaper, definitely, because employee, if they fall sick, then they have to do the claims later. So they only pay for what they actually seek for treatment for. But if a company with multi-subsidiary, so for example, they have outlets in different parts of the country, then it's very difficult for the employees to do the claim. Okay, so employees sometimes have to see a doctor first, okay, pay for the treatment themselves out of their own pocket first, and then collect back the receipt and then pass it back to HR. Then the HR has to administrate all the different claims process. And then after that, we'll go to the payroll, and then the payroll will actually disperse it to the employees probably a couple of months later. So this whole process is actually very, very tedious. So we done that by using our platform. We link up with all the doctors. What happened is employees don't have to fork out any cash. Everything is cashless. What they need to do is to go to any of our panel clinics. They scan the QR code at the clinic, and then the HR and the employees will straight away receive a notification to tell them that how much is being used and how much is their entitlement left with.
Okay, so Clarence, I see this as a benefit for a large company, particularly in terms of outpatient treatment, where the volume of claims is very significant. So basically the company can self-insure their outpatient,
yes,
while then reinsuring or insuring their risk on an inpatient perspective. So is that how generally your clients work with you?
Yes, but of course, different clients, different companies have different type of benefits. Okay, so for example, the larger clients, okay, the MMC, they might have certain budget to help them to cover for the employees. Okay, so budget might not be the topmost important factor for the bigger clients. Okay, so what happens is they want a platform to help to manage. okay, without a platform to help them manage, right, it's very tedious. So as I said just now, if you got different outlets or different branches everywhere, it is tedious to do the reimbursement method to seek out all the different claims of the employees. The HR probably have to hire a few more people, okay, just to do this manual claims and all this. But for smaller companies, then the cost will be the issue, okay, because they can't afford the high premiums that's charging by the insurance company to provide coverage that the employees might not be able to use. So we actually balance between the two. We help the HR to solve all the typical claims issue, and also help to reduce the cost for the companies. So different companies, they actually seek different type of coverage and benefits and different needs, which we can able to solve for them.
And Clarence also, and I'm just thinking as you've been explaining this, one of the key benefits from HR is really that ability to have visibility in terms of data.
Correct.
Now, if they are just paying and claiming, it's hard to make sense of what some key trends are, who is abusing the system,
Correct.
and so forth. So obviously, a data-driven platform like yours will enable more real-time information for HR.
Correct. So what I've seen personally is previously before us, some of the HR don't even use Excel to actually to keep track of what the employees spending. Imagine there's hundreds of employees. So what they do is they use pen and paper, staple the receipt of the claims on the claims book. Okay, then they have to track manually. So they totally don't have any data. So imagine at the end of the year, they want to do some data analysis, how much they spend or which employees spend how much. They totally can't get the information out. They take out the book, they take out the scrapbook and have to check. Okay, some use Excel, but Excel, they only give limited coverage. They also need to sometimes to tabulate all this information to the system. Okay, so for us, we provide a platform for them to actually see straight through instantly at any time that they want. They can pull out all the reports that they want to see how much claims, which employees spend how much has the company been spending. Okay, all this information at the click of their hand. So it's that simple for the clients.
Now, Clarence, could you shed some light and break it down for us in terms of how you charge clients and the different sort of cards that you have in your portfolio?
So from our website, you can see that we actually have 3 cards. Okay, so that's how we charge our clients also. We make it simple. So the first card that we have, it will be the postpaid card. So postpaid, as the name suggests, right, is whatever is totally free. Okay, our platform is free. You don't have to pay a single cent. Okay, only upon usage, then we'll bill the client. Okay, so for example, a client with 100 employees, example, and 2 employees actually spend the entitlement this month, example. So one spend 50 ringgit, the other spend 100 ringgit, example. So total will be 150, and we will bill the company 150 ringgit at the end of the month. So that's our first plan. A dollar for dollar, there's no cost at all. So the company only pay for what they spend. Our prepaid card, right, is our promo plan. I'll say it's a promo plan. Okay. What it gives, right, is we calculate the total entitlement that the company has for the start of the year. For the start of the year, okay, what they used last year. So example, a company spent 100,000 for their employees' benefit the last year. Okay, what our promo does is we help the company to save costs. Company only need to pay us 50,000. We will top up the other 50,000 to make it 100,000. So it's 100% bonus to give to the clients so that they can help to cover the cost. We understand that currently that there's a rising cost, inflation, and uncertainty, right? So what we do is we help the company to manage the employees' benefit costs by using a prepaid plan. You pay us 50% of what you are using last year. We will top up the rest of the 50%.
But how do you make money then if you're doing that? Okay,
so a lot of clients actually ask me this question also. Definitely, I can share definitely. This is promo plan. Okay. What we do is we are a B2B platform. Okay, we see a lot. There's a lot of B2C platforms out there. Very good B2C platforms out there. What they do is they do a lot of online advertising. They do a lot of TV advertising, radio advertising, a lot of marketing costs. So we do have a certain marketing cost. Okay, what we do is instead of this marketing cost, we actually spend on advertising. we spend this marketing cost, give it to the client directly. Give it to the client directly so that they can enjoy the benefits and they understand the platform and to use. So what we do is actually our marketing cost to help the company to ease and tide through these difficult times.
Okay, that's interesting. Now, could you share some success stories that of how you've helped businesses automate their employee benefits, and maybe you can share some numbers in terms of what sort of savings that they were able to get?
Oh, sure. So I think one of our more success story, I think people heard about 7-Eleven. So 7-Eleven is one of our biggest client. They have outlets throughout Malaysia, both in Peninsula and also Sabah Sarawak. Okay, what happened is before us, right? Okay, what they did is they do cover for the employees for outpatient coverage, which is very good. Okay, but what happened is when employee fall sick, okay, they have to do the pay and claim method, reimburse method, which I mentioned just now. Okay, employee go and visit a doctor, they pay a certain amount first, okay, take the receipt, come back, pass it to the local team, and then send it to the HR team in KL to do the reimbursing. Okay, after approval, they'll pass to the payroll team. Okay, the payroll team then will do the disbursement. That will take a couple of months later before they actually get back reimbursement. Okay, so that is a true example. What happened is once we actually came over and we realized this issue, now employees are all empowered. They know their entitlement. All the 7 employees know their entitlement. They know where is the nearest panel clinic. They know where how much their entitlement is left with. Okay, when they visit the clinic, everything will be cashless. They don't have to fork out any cents. Okay, any dollars. All the companies have provided for them already. Okay, and the HR don't have to do all the complicated entitlement deduction and all this. Everything is recorded in the platform real time. So this is one of the very successful case study that we help the company to automate the whole system, and employees are happier in this way also. HR too.
Now, Clarence, that's very interesting. I want to move to something that you've just done in terms of your 2022 employee benefits and trends reports. Now, that report is highlighting the rising cost of healthcare benefits in Malaysia and Singapore. Could you give us some insights into the survey itself, the methodology, and what are some of the key findings?
Okay, so what happened is we surveyed 200 HR decision makers who have significant influence over HR-related decision of companies that currently do provide employees medical benefits. So half of them is from Malaysia, half of them is from Singapore. Okay, so these employees, right, must be working in a company with a size of around 10 to 250 employees, and cannot be working in any insurance company, brokers, or banking institution. Okay, so within the survey, right, we find out that 75% of the companies, right, do provide hospitalization coverage, GP coverage, and wellness coverage for their employees. So these are the three typical main important coverage that the companies do provide for them.
And Clarence, you see, one of the things that many companies don't realize, and I suppose that 25% of companies that don't provide this don't understand, is the fact that for many employees now in the war for talent, medical benefits is one of the key talent attraction strategies.
Exactly. So a lot of companies, right, what they do is they actually this 25% of them, they actually neglected what the employees wants, because now employees are actually also more well educated. They're actually smarter. They want to see the total package that the company provides for. Of course, salary is still the main bulk, but they're actually looking at what the companies can provide also. So whether is it the medical coverage, the wellness coverage, the type of different coverage that the employees can enjoy besides just the salary that the companies can enjoy. So actually medical coverage is actually very important for what we actually survey from the employees also.
Now, Clarence, one of the key things that is plaguing or worrying employers is the rising cost of healthcare. Now, healthcare inflation is far outstripping traditional inflation, even in this high inflationary environment. Prior to COVID, you basically had mid-teens in terms of inflation for Malaysia and Singapore. what are some key things that perhaps employers could do to reduce their rising cost of healthcare?
Okay. So firstly, right, they need to actually have a deep dive and analyze, right, what type of coverage that the companies provide currently. So for example, a typical company, they actually provides insurance coverage, for example, which is good, very good, okay? But they need to understand how many of the employees are actually enjoying these type of benefits. So if your employees stays healthy and don't fall sick, actually this coverage is not utilized at all, okay, especially a younger workforce, okay, they're not utilizing whatever the coverage, insurance coverage that the companies provide for them, and means that the company is actually spending dollars on something that the employees don't need, and the dollars are wasted, okay. If they actually switch to a flexi type of platform, which the employees want, so for example, the same dollar, the same amount, okay, but they're actually covered for probably gym coverage, wellness coverage, spectacles, dental, health screening, something that the employees can do more for prevention than cure. This is something that companies can do to help to save costs, yet the employees get to enjoy the benefits that the companies provide. Win-win situation for all parties. So need to deep dive to understand what type of coverage that they're providing and how much cost they can save.
Clarence, it's been a very informative conversation, and I've really learned a lot. But before we leave, any final thoughts you'd like to leave our audience with?
Yeah, so firstly, check out our website, mednefits.com. So we help companies to manage the employees' benefit and lower their costs for what they're paying for by using technology. So by using technology, we link companies straight to the healthcare providers, okay? And we want to create a healthy and happy workforce, because this will help the companies in the short run and in the long run.
Now, Clarence, thank you very much for taking your time to come on the show.
Thank you, Brian.
Now, I'm Brian Fernandez, and we've been speaking to Clarence Zhang, the co-founder and country manager for Malaysia Mednefits, on Biztechasia Health and Wellness Show. Now, this show will be on our website, www.biztech.asia, as well as our social media platforms. It'll also be on our syndication partners, TV stations, radio stations, and websites. Thanks a lot for tuning in.